So I have the pleasure of introducing our lunch keynote speaker, Rajiv Uppal, Director of the Office of Information Technology and the Chief Information Officer for the Centers for Medicare and Medicaid Services. In this capacity, Rajiv provides leadership across the enterprise in all areas of information technology, including security and privacy, enterprise architecture, and IT investment planning. Rajiv is a visionary, technology executive, and a great leader with 25 plus years of experience in enterprise software, leading development from concept to launch of software applications, managing large, complex IT programs, steering IT strategic planning, and applying best practices in IT management. Welcome, Rajiv.
Thank you. Thank you, Diana. You guys can hear me okay? Okay. Let me get this set up a bit. Excuse me. So it's a pleasure to be here, an honor and a privilege. I thought I'd start by giving you maybe a couple minutes of my background. As probably some of you are familiar, most of my career has been in the private sector. And specifically, I've been involved with software startups. My first startup was, of course, I'm dating myself. This is the internet boom time, and we had a product for building applications for application developers who didn't want to necessarily have to be bothered with the complexities of technology, but rather giving them the opportunity to focus on actual business issues and business logic. So that was the first startup that I was focused on, and the second one that I got involved with was actually a completely different industry. This was focused on the retail sector, really big brick and mortar retailers like Giant Foods and Safeway. And some of you may know, but they carry anywhere between 30 to 50,000 products on their shelves. And they need solutions to help them accurately predict what is the demand for all the products that they carry on the shelves. Because you may not know, they actually do not have big backrooms. So they actually need to make sure that they get just enough product that they will meet the demands of the customer. So they don't want to stock too much or too little, either way. So that company actually provided predictive analytics solutions for the retail sector. So after I got done with these two startups, I had the opportunity to join US Digital Service. And this was in early 2016. It was actually a great opportunity. I got the chance to meet a number of people, work in a number of agencies on software projects. And the unique thing that US Digital Service does is, they try to bring the customer perspective. And for all of us who've been in the private sector, that's what you always focus on anyways, because if you don't make the customer happy, you're not going to be able to sell your product. And so it was actually a very, it was a great experience for me in the digital services. And about in June of 2018, I got the chance to come over to CMS as their CIO. And that obviously has been one of the best experiences up to date, that we've been involved in all kinds of innovations. And I'll start by giving you a little bit of a background about CMS itself. So I'm not sure how many of you know, but on July 30th, 1965, our 36th president, Lyndon B. Johnson, was the one who signed into legislation what we call today Medicare. That's how we all got started with the system. And one of the first people to actually enroll in the Medicare system was our 33rd president, Harry S. Truman. And the second one was actually President Truman's wife, Bess. And from what I know, during the first year, they enrolled about 19 million folks into Medicare. So quite an accomplishment for the first year. So Having said that, so when we, even though Medicare got started in 1965, as an agency, CMS first got started in 1977 as the Healthcare Financial Administration. And in 2001 is when we became the Centers for Medicare and Medicaid Services. We have about 6,200 employees, a lot of them at our headquarters outside Baltimore, and we have about 10 regional offices, and so employees distributed between the headquarters and the regional centers. Now, with regards to our programs, the Medicare and Medicaid programs that, as I was saying, they started in 1965, CMS administers public insurance programs that serve the primary purpose of providing health care to seniors, as well as a pretty large population of medically vulnerable individuals. Obviously, we couldn't do this without our partners, meaning the hospitals, our states, as well as providers and contractors. As you probably know, some of the recent mandates, like the Affordable Care Act, as well as the Medicare Access and CHIP Reauthorization Act, that actually significantly expanded what's in the purview of CMS. And here's an interesting fact that I have. By fiscal year 2020, over 145 million Americans will rely on programs that CMS administers. That's a combination of Medicare, Medicaid, the CHIP program, as well as the exchanges. So it's a fairly large number, 145 million. Our IT portfolio is also fairly vast and significant. The major investments, so these are investments with over $10 million a year of funding, account for about 94% of our IT portfolio. So fairly large IT function that we have. Also, here's some interesting fact. Actually, I think I forgot to move the slide here. There you go. The way on the bottom there, we process about 1.25 billion claims and paid out about $701 billion in fiscal year 2018, which, if you do the math, it works out to about 443,000 claims worth about $80 million per hour. So that's the size of the operation that goes on. And in terms of IT funding for 2019, fiscal year 2019, as reflected in our 2019 operating plan, our budget our IT budget is $2.8 billion. Okay, moving on to the next slide. Okay, so I'll talk a little bit about how we focus on burden reduction. So given our significant budget and program reach, it is critical that we have strategies in place that help us promote value as well as efficiency. CMS is ensuring America continues to have a world-class healthcare system by unleashing innovation and technology, as well as medical records, and removing barriers to innovation and competition. With regards to technology, we have to ensure that our services and operations evolve along with the advancement of modern IT, in order to enable and support achieving our CMS's strategic goals. Our vision and our mission and our vision of having a high-quality healthcare system, achieving better healthcare as well as enhancing the access to coverage and improved health. So these approaches can be seen through some of the processes that we employ and the technologies we implement with our vendor partners. Actually, whenever I meet with a lot of our vendor partners, I usually talk about the fact that a lot of the vendor partners who will come and visit us will obviously talk about the solutions or the products that they have. And I always implore and say that it would be really helpful if you take some time to listen to the challenges that we face. And if you can listen to the challenges that we face to then tailor your products and solutions to how they may help us meet the needs that we have and the challenges that we have. So let me talk about some of the initiatives that we have. You heard about patients over paperwork. Again, this is again to reduce the burdens on the patients and their doctors. And programs like the Quality Payment Program you may have heard of, that was established to meet the needs of the Medicare Access and CHIP Reauthorization Act of 2015. CMS has moved away from traditional approaches to delivery of IT by embracing flexibility and innovation to improve the quality of service we provide to our internal customers. And I'm speaking really from since as the CIO, I run the Office of Information Technology, and we serve to a large extent, our customers are internal to CMS. And what we are trying to do is change our culture internally, so we encourage our partners within CMS to practice some of the more modern IT practices. And so things like using human-centered design and other things. So because if we start doing those things internally, that'll obviously lead to products that we put out for our people that we serve, eventually our beneficiaries and providers, which are much more focused towards their needs, as opposed to putting out products that may not hit the mark. So we're trying to change the culture internally so we can do a better job of putting out the right products for our customers. So let's see, let's move to the next slide here. So as I was saying, we're trying to become much more customer focused and service oriented with our customers internally, providing a positive experience and reliable processes to our internal customers actually enables the agency to meet the needs of our external customers, as I was just saying. And the external customers, in this case, I mean the beneficiaries and the stakeholders that rely on the services that CMS provides. Then the basis for these changes has, for the most part, been the adoption of the agile methodologies across CMS, the whole agency, and our business partners. And when I refer to our business partners, I also mean these are the various components within CMS. And you've heard of components like CCSQ or CISIO. There's a number of our Centers for Medicare. These are all components within CMS that we serve and help put out applications and systems. So in an effort to improve the quality of service that we provide to our internal customers, we have initiated human-centered design, customer-focused research projects to obtain the feedback from our customers in ways that we could improve our service. As a result of this project, we actually mentored and led new staff to apply human-centered design. And as you can see, we've actually focused quite a bit on human-centered design, so to ensure that the products that we are putting out actually do hit the mark. And this was a human-centered design project focused on employee onboarding and the hiring process. Previously, this used to be a 3-day event that people would have to go through, and at the end of that, the new employees would end up with a laptop that they would go sit at their desk and try to connect to the email. Now it's been completely changed around. When a new employee joins CMS, it's a half-day event, and we actually go and give the laptop to the employee, sit down with them, make sure their email is working. So again, changing our perspective of how we treat our customers internally, so in turn we will do a good job treating our customers externally. So one of the other things that I want to talk about, for patients over paperwork, we did a similar thing. We had about 7 on-site human-centered design engagement teams focusing on nursing homes, beneficiaries, clinicians, hospitals, hospice, home health, and dialysis facilities. Now, this is pretty interesting. All of these teams, they participated in site visits, did customer interviews to gain insights of our stakeholders. The patients over paperwork human-centered design teams, and it'd be interesting to note, held about 164 subject matter expert interviews, about 528 customer interviews, about 81 listening sessions, and collected over 12,000 points of data. And the teams reached more than 1,300 people, which is with a really innovative approach. They had something what they called as an event in a box that they would send out to our regional offices so they could do the human-centered design research project within the regions across CMS. So this has been a very popular program and a very successful program within CMS. Now, so obviously CMS is very committed to empowering business flexibility in IT system development, making obviously sound investment decision and complying with federal IT laws and regulation. And the reason I say that is, as I'll talk about further, while some of the processes that we're changing internally that apply to IT governance, is people may think about it, hey, are we trying to make things easier so people don't have to comply with the needs of whether it's the laws or regulation, but that's not the case. We want to make sure we obviously comply with all the IT rules and regulations, but in addition to that, what we are trying to do is create an atmosphere where people are encouraged to build more robust applications and use better technologies and architectures. So let me move to the next slide. So I'm going to talk about a little bit about governance here. So how we are evolving the governance model. It used to be that we would always have gate reviews. So we have within CMS something called as a TRB, which is a review board, and not a very well liked place for most people who have been there. And as a result, what ended up happening is you end up with a tremendous amount of what I would call, or is often called, shadow IT, where people just build systems and just never let you know. So you don't have an idea, something's running out there. So to counter that, really what we wanted to do was create a governance model that is more enablement focused as opposed to just focused on having gate reviews. So, and also the other aspect of the governance model is that the governance model as it existed previously was focused on the way applications were developed before, which was, you went through the requirements phase and design phase, the waterfall model, and now there are a lot of teams that are doing true agile, and the governance model needs to adapt to that new way of developing applications. It needs to be flexible. And more than just being flexible, we need to have a culture where we are actually encouraging people to do the right thing as opposed to making, just having them do, you just need to have a design document that looks a certain way. Otherwise, it's not acceptable. So again, as I was saying, the new governance model is more enablement focused, and it's sort of, it replaces the point in time gate review, this continuous evaluation and situational reviews. Not that we won't do reviews, but it'll depend upon the kind of project you have, the kind of project team you have. There are a number of business components within our organization that are really good at what they do, and they don't need oversight. As long as okay, these guys are involved, you can be fairly certain. And in fact, it's not just the organization, it's sometimes is also the business partner that we're working with and the reputation that they have. We know, oh, here's a business partner we've done work with, and they've always come to task and done the job right, and that gives us a sense of, okay, these guys will do it right. They know what we expect and will work out well. So the same thing, also comes to in terms of security. If you look at our, authority to operate, the ATO process, traditionally it's been a 3-year ATO process, and we're trying to change that as well. We want to make that into an ongoing authorization process through rigorous information security and continuous monitoring. Again, as part of the governance, that the change we're trying to make is don't think of security as something you do at the end, and that becomes mostly a compliance exercise. And we want to get away from just compliance to actually focusing our energies on actual security. So you're thinking about these things up front as part of the governance process. And obviously, as most of you know, we are also making a significant move towards the cloud, and we are developing new infrastructure, and I'll talk about that in a minute. But before I talk about that, let's talk a little bit about our workforce and some of the things that CMS Workforce has done. You might have heard of the Quality Payment Program. The Quality Payment Program established a service center philosophy that the service and support experience should drive customer happiness. And it was married with an IT architecture solution that enables seamless escalation of interaction with the customers. And the interesting thing is, if you look at the QPP Service Center results, they exceed some of the industry standards. They have satisfaction rates of over 90% and first call resolutions of over 83%. And with minimal capital expenditure and reduced operating costs. So this has been a really great success story there. Now talking about, as I was saying, about the cloud infrastructure that we're putting together. So we are in the process of putting together a CMS cloud infrastructure that is focused not just on automation, but also on security, but also a cloud architecture that's maintainable. We are focusing on a cloud system that increases our systems and operational agility as well as resilience of the applications. We want to enable simpler and optimized deployments to reduce time to market for both business and system owners. And last but not least is how do we use that platform, the cloud platform, to encourage and enable modern development practices. So if we have all of the pipelines, the CI/CD pipeline, and all of those things in place, so people don't have to go develop those things again and again for every project, we will encourage that behavior more so. It may be interesting for you to know, we started down the cloud journey about in 2014, and I was talking to the head of our infrastructure division, part of the Office of Information Technology, Marco, and he mentioned over the past few years, our cloud footprint has grown by 30% year over year, and this year even more so. In fact, Bobby's here, and I think if you're at our last annual IT conference in August of last year, you probably heard CISIO announce that they were consolidating and migrating the health exchange marketplace from the on-premise data center to the cloud. And happy to say that they successfully did that on 31st of March and without any interruption to service. So that was a great achievement. There are numerous, there you go. And so there's actually quite a few other systems that are right now in the middle of moving from on-premise solutions to the cloud. It obviously does take a while. They're moving in various. Some of them are taking the opportunity to make the move by actually doing a re-architecture where it's appropriate. Others are what traditionally is called sort of doing a lift and shift for now, and then once they're in the cloud, they'll make the changes that they need to make. But either case, there is a lot of migration to the cloud happening at CMS. So the other big topic, other than the cloud, obviously is data. And we generate data in various programs at CMS. One of our strategic goals is to leverage this asset to attain more insights into the data we have so we can provide more cost-effective care and also lead to patient health outcomes, better outcomes. In the past, this has been a challenge because due to the fragmented nature of how how the IT systems have come about, we have a lot of siloed repositories of data. Over the past few years, CMS has been working to provide interconnectivity between some of these siloed repositories of data that we have. One example is the Center for Medicaid and CHIP Services, CMCS, has made big strides, and they actually build a unified data view of the dynamic landscape of Medicaid and CHIP program. This program has about 72 million beneficiaries. So now just imagine, this gives CMS an opportunity to look at this data and answer questions like, well, what benefits and services do beneficiaries use or don't use? And what is being used too much, and how do demographics play into that? So there's a number of questions you can start asking and answering once you do have a unified view of data and you can do the analytics. And as all of you know, patient information is often trapped in siloed health systems, which prevents patients from accessing their complete health information. We're trying to undo some of that, and one of the ways we've done that is through the Blue Button 2.0, if you've heard of that initiative. The Blue Button 2.0 gives seniors more control over granting application developers access to their Medicare records. So the information can then be used to improve and increase positive health outcomes. Interestingly, since that has been done, there's about 1,400 developers working on new applications to serve the seniors. In addition to that, we also made Medicare Advantage data, which is now available to researchers. So all these are some of the steps that have been taken. The other step that we've taken recently, we're requiring clinicians and hospitals to adopt the 2015 edition of certified EHR technology, because this version supports API capabilities and will ultimately support improved health patient access. The other project that CMS has been supporting is the Vinci Project. It's a private sector initiative led by HL7, and CMS actually has engaged the entire community to transform some of the accessibility to data. In the past 2 months, we had our first data and API summit, and that was a very successful summit for us. In the 2-day event, we had project teams share their specific challenges, ideas to work together and organically find ways to develop different approaches and to advance the access of data with the use of cloud or other technologies. So and of course coming up with maybe potentially using common practices for APIs. So what we are hoping is that, as we did with the API Summit and the Data Summit, that we do that on a more regular basis. And earlier, when I was speaking with Bobby, and we was talking about the fact that IT governance is one way that you can influence people about how to build better solutions and better IT. But the other key part of doing that is having a lot of outreach to all of our business partners within CMS and outside of our people who support us. Outreach so we are all on the same page as to what is important to us, how we want to move forward, what kind of technologies and methodologies we would like to use to move forward in our journey. So talking about that, so we are obviously on a journey to improve healthcare. Technology and sharing of data underpin the entire move to innovative mechanisms in healthcare. Without data to track patient progress or understand quality, insurance companies cannot tie payment to outcomes. As part of our strategy, we are also fearlessly searching for innovation that CMS can consume to make this happen. We are encouraging our workforce and our vendor partners to rise to the challenge that embracing these technologies and innovations brings. We are working with our business partners and trying new ideas and technologies. We are taking advantage, as I was talking before, we are taking advantage of cloud environments and leading edge architecture that we've established to pilot technology solutions that can dramatically change our effectiveness. We are trying to harness technologies to deliver a superior customer experience, and as I had mentioned before about the human-centered design efforts, again, to try and build that culture where when we are about to build a solution, it isn't about, oh, we need to build this, let's just go give it to a team of developers who will go and build it, but to spend the time, make sure we understand the needs of the customer, and we put out the right kind of solution for the customer. CMS would like to invites all to be part of these improvements, to become partners to further the journey to improve healthcare, help us find innovative ways to apply IT to improve customer experience and maximize the ways we use our data. That really is very key for us. After all, it is about the people, the people who work at CMS, the people that support CMS, and the people that CMS serves. So, with this, I'd like to thank you all for giving me this opportunity to speak here. It's been a pleasure, and I wish you all a great afternoon. Thank you very much.